Good evening, everyone. Today's my topic is financial management in healthcare, where I would be focusing more on the budgeting, insurance, and cost control in the healthcare sector. I am Arpita Mukherjee, a PhD management scholar. So, moving ahead with my today's topic, financial management. Financial management is the process of planning, organizing, controlling, and monitoring financial resources to achieve an organizational goal efficiently and effectively. It involves making strategic decisions about how to acquire, use, and protect funds to ensure financial stability and growth. In healthcare management, financial management plays a crucial role in ensuring that healthcare institutes remain operational, sustainable, and capable of delivering quality patient care. The objectives of the financial management: maximization. It ensures that the organization earns sufficient returns on investment and operation. Next is the wealth maximization or shareholders value. Focuses on increasing the overall value of the business for the stakeholders over the long term. Next objective is ensuring liquidity. Here, we mainly see and maintain the adequate cash flow to meet day-to-day expenses and liabilities. The fourth objective is efficient resource utilization, where we avoid wasteful spending and ensure optimal use of financial resources. The fifth is financial stability, which keeps the organization solvent and capable of handling unexpected financial challenges. And the sixth objective is growth and expansion, where we support strategic decisions that lead to organizational development. There are different principles of financial management, such as consistency, accountability, transparency, viability, integrity, etc. So, the consistency is about applying financial policies uniformly over time. Accountability is the responsible use of financial resources. Transparency is when we clear financial reports for the stakeholders. Viability is ensure decisions are sustainable and feasible. And integrity is adherence to ethical financial practices. Types of financial management. It could be capital budgeting or investment decision, capital structure, financial decision, or working capital management, short-term financial decisions. Now, let us look into it individually. So, the capital budgeting or investment decision it is the concerned with long-term investment decisions such as purchasing new equipment, building new facilities, or adopting new technologies. The purpose is to evaluate the profitability and risk of long-term investments. Examples in healthcare are buying MRI or CT scan machines, building a new hospital wing, investing in telemedicine infrastructure, etc. Next is the capital structure or financial decision. Here, focuses on how an organization raises capital, the mix of debt and equity financing. The purpose is to decide the best financing mix to minimize cost and maximize the values. Examples in healthcare are taking a loan to finance hospital expansion, issuing bonds for new facility constructions, choosing between government grants and private investments, etc. The third is the working capital management or short-term financial decisions. We manage the day-to-day financial operations to ensure sufficient liquidity. The purpose is to maintain the organization's ability to meet short-term obligations and run daily operations smoothly. Examples in healthcare are managing cash flow to pay salaries, buy supplies, and pay utility bills. controlling inventory of medicines and medical supplies, ensuring timely billing and collection from patients or insurers. What are the importance of financial management in healthcare? First, it supports patient care and it ensures that resources are available to provide high quality medical services. Second, controls the cost. It helps identify areas of overspending and implement cost saving measures. The third is enable data driven decisions, where the financial analysis supports strategic planning and performance improvement. The third is sustain operations, which avoid services disruption due to lack of funds or poor planning. Regulatory compliance prevents legal penalties by adhering to healthcare financial laws and standards, and promotes expansion by funds facility development, advanced technologies, and training programs. Challenges in healthcare. What are the different challenges that we get to see? First is rising cost, where increased price of drugs, equipment, and staff salaries could be a major concern. Next, complex payment systems where dealing with multiple insurer billing codes and reimbursement delays could be some of the examples. Regulatory pressures where adhering to strict government healthcare regulations, uncompensated care where treatment uninsured patients without reimbursements, and resource scarcity, limited funding versus growing patients' demand are some of the examples for the challenges in healthcare for the financial management. Now looking into the budgeting part for the healthcare sectors. Budget Budgeting is the process of creating a financial plan that estimates income and expenses over a specific period. In the healthcare sector, budgeting ensures that hospitals, clinics, and other health facilities allocates their financial resources efficiently to meet clinical, administrative, and operational needs. The different types of budgets in healthcare are operational budget, capital budget, cash budget, departmental budget, and program or project budget. The operational budget is the day-to-day expenses that we deal with. For example, the salaries, supplies, utility, patient care, etc. The capital budget is the long-term investment, such as the investments that we do in the buildings or in the equipment purchasing or new technologies, etc. The cash budget forecast of the cash budget is the forecast of the cash flows, inflows and outflows to ensure the liquidity. The departmental budget is the budget for individual departments. Example, the budget that we prepare for the emergency department or the radiology department or ICU, etc. And the program or project budget. The specific healthcare programs, for example, the vaccination drives or the outreach clinic programs, the budget that we might require for them is the program or the project budget. Next, things to keep in mind while budgeting for the healthcare. So the different considerable points are patient volume forecasting. It helps in estimating revenue and demand for resources. The regulatory requirements. The budget must comply with the health sector rules and funding criteria. The staffing needs. The salaries are often the largest expenses plans based on patient load. Technology and equipment upgrades. Budgets for new system, example, electronic health record, diagnostic tools, etc. Emergency preparedness. Allocation of resources or allocating reserves for pandemics, disasters, or urgent repairs. Cost control measures where implements strategies to avoid overspending. Stakeholders' involvement include department heads, finance team, and medical staffs in planning. And performance matrices, use of data, example, cost per patient, bed occupancy rate to guide for the planning. The different steps to prepare the health budget are: first, we should have a clear objective. What kind of budget we are planning, or why is it important, or to define the goals of the healthcare facilities for the upcoming periods. Example, to improve the patient's wait time, purchase new equipments, or hire more nurses. Whatever the objective is, first we have to have a clear objective. What is the purpose for which we are planning to make the budget? Next is the collection of the data. Here, we have to analyze historical financial data, past expenses and revenues. Consider patients' volume trends, staffing needs, and service demands. Third step is the estimate revenue, where the project income from patient fees, insurance reimbursement, government grants or subsidies, donations or partnership, etc. should be looked after. The fourth step is estimate expenses. Here, we have to first decide what are our fixed costs and what are our variable costs. So the examples of fixed cost are, for example, salaries, rent, loan, repayments, etc. And variable costs are medical supplies, maintenance, electricity, etc. So these things should be decided or estimated properly. Next step is allocation of resources. Here, distribution funds to departments based on priorities and needs. Use performance indicators to support your decision. The sixth step is revenue review and approval. So present the draft budget of manage to the management or governing board, make necessary revisions and obtain the approvals. And the last step is the monitoring and adjustments. Continuously track spending versus the budget, make adjustments if income drops or emergencies occur. So these were some of the steps that we need to follow while preparing the budget for any healthcare organizations. Next are the examples of budget line items in the hospital. Example, personal cost. Here, the doctor, nurses, admins, salaries are to be taken into account, overtime benefits, etc. For the supplies, we have to look after the medical equipments, drugs, PPE, office supplies, etc. Operational cost mainly involves the utilities, waste disposal, laundry, food services, cost, etc. Maintenance and repair includes the facility, upkeep, equipment servicing, etc. Capital expenditures includes new building, MRI machines, ambulance purchase, etc. IT and software, where the health record system, cyber security, licensing fees should be included. So the budgeting is the healthcare in the healthcare sector is essential for financial sustainability, efficient resource use, and quality patient care. A well-prepared budget aligns with financial planning with healthcare goals and helps respond to changing needs while maintaining compliance and cost control. Next, moving on to the insurance in healthcare. Health insurance is a contract between an individual or organization and an insurance provider, in which the insurancer agrees to cover all or a portion of the policyholder's medical expenses in exchange for premium payments. It helps protect individuals from high or unexpected healthcare cost. Insurance in public health system. In many countries, insurance is a key pillar of the public health systems, either through universal coverage model, as we can see in UK for the national health schemes, or the social health insurance under the Germany statutory insurance, or the government funded programs, example Medicaid in US and even in India. So next. the types of health insurance plans. In India, we can see different types of health insurance plan, which includes the private health insurance, where it is provided by a private company or a private player. So provided by private companies, example, employer-sponsored plans. Next is the micro health insurance, where low-cost policies for rural or low-income populations are mostly taken into care. Managed care plans, it includes HMOs, PPOs, and focuses on cost control and provider networks. Group insurance covers a group of people, often employees of a company, are involved in this kind of insurances. Individual plans were purchased by individuals directly from the insurance providers. And the public or governmental insurance funded by the state, example, Medicare, Medicaid, NHS, Ayushman Bharat, etc. So the different roles of the insurance in healthcare sector are: first is the financial protection. It covers the cost of the medical treatment, hospitalization, surgeries, etc. The access to care. It encourages timely use of healthcare services due to reduced out-of-pocket cost. Risk pooling spreads the financial risk of illness among a large group of people. Encourages preventive care, where many insurance plan covers checkups and screening, reduces long-term cost. It stabilizes provider revenue, where the hospital and clinic receives payments from insurer, improving cash flow. And supports health system, where the public and private insurance funding forms the backbone of the healthcare finances. The key benefits of the health insurance in the healthcare sectors are: first, it covers major medical cost, which includes hospitalization, surgeries, diagnosis, treatment, etc. It is a cashless services, where many insurances offers direct payment to the hospitals, and no upfront payment is required. Pre and post hospitalizations. It covers expenses like test and follow-ups, where your pre-treatment and your post-treatment or post-hospitalization cares are all covered. Maternity and childcare. It includes delivery expenses, vaccinations, and newborn care. Mental health coverage, where increasingly include in the modern health insurance policies. Tax benefits, it is the premiums are often tax deductible in various countries, and it helps the people of that particular country. And peace of mind, it reduces the anxiety over medical expenses during the scarcity or during the emergency period. Next is the challenges in the health insurance. What are the different challenges that we have to face while we take up the health insurance schemes? So under insurance, many a time it happens that the people have insurance, but the coverage is inadequate. Many of the tests might not be included in the insurance, or many of the treatments might not be included in the insurance part. So these are the under insurance. Claim rejections. So issues in paperwork or policies clauses lead to denied reimbursements. Limited provider network, where some plans restrict access to specific hospitals or doctors. Fraud or misuse. False claims or billing fraud affect sustainability. So when you were taking the insurance, that time many false promises might have been made, and when the time has arrived for you to use those promised things, you come to know that those were all fraud, and nothing such facilities are being provided to you by your insurer. So again, a difficult time. Awareness and literacy. Many people do not understand policy terms or their rights, and thus faces problem. So health insurance plays a critical role in the functioning of healthcare system worldwide. It not only protects individuals and families from financial hardships, but also ensures the efficient delivery of health services, better outcomes, and equitable access to care. For governments and healthcare providers, insurance ensures stability, predictability, and stability. Next is the cost control in healthcare. The cost control in healthcare refers to strategies and practices aimed at reducing unnecessary spending, improving efficiency, and maintaining or improving the quality of care. It ensures that healthcare resources are used wisely without compromising patient outcomes. The objectives are to improve resource allocations by using funds more wisely across the departments or services. Next is improve resource allocations. Next is the maintain quality of care where ensure patient still receive safe and efficient treatment. Improve efficiency where streamline operations and reduce delay or duplications are to be looked after. Reduces waste where eliminate unnecessary test procedures and administrative costs. And the financial sustainability, which keeps a hospital and health system solvent and operational. The different methods of cost control in healthcare systems are the budget and forecasting, where set spendings for spending limits for departments based on past performance and future projections. Next is the standard treatment protocol. Here we use evidence-based clinical guidelines to reduce unnecessary variations in care. The third is generic drug use. Here we replace branded medicines with the cost-effective generic medicines. Fourth is the preventive care initiatives where uh, invest in vaccines, screening, and health educations to avoid costly diseases. Fifth is daycare surgeries. Here, we perform minor surgeries in OPD settings to reduce hospitalization cost. Sixth is the length of a stay reduction. Discharge patients faster by improving efficiency in care. Seventh is supply chain management, where uh, negotiate mm, negotiate better prices and manage inventory more efficiently. Eighth is the digital health solutions, where we use telemedicine, electronic health records, and automations to save time and money. Ninth is the value-based payment models, where pay providers based on outcomes insert to volumes, example bundle payments. And task shifting, where um, delegate appropriate tasks to lower cost healthcare workers, example nurses. And the last is the energy and facility management, where reduced utility bills and improve energy efficiencies in healthcare buildings are to be taken care. The cost control techniques for the hospitals. So the different cost control techniques are: first, the activity-based costing or the ABC, to assign cost more accurately to services based on actual activities. Second, cost benefit analysis. Here, we evaluate whether a treatment or intervention is worth its cost or not. Third is zero-based budgeting, with justifying every expenses from scratch, not just changes from the last year. Fourth is the internal audits, where we review spending patterns and identify insufficiencies. And fifth is the performance benchmarking, where we compare performance and cost to the best performing institutes. The challenges that we face while we try to do the cost control in the healthcare system. First is the maintenance of the quality. Cutting the cost too aggressively may reduce the quality of care. So here we have to implement the lean management very carefully so that the quality of care for the patients do not go down. Resistance to change. The staff and stakeholders may resist new processes or protocols. So we have to make them aware of the changes that we are trying to implement. We have to motivate them. We have to bring into their confidence, and then only we can bring the changes with their support. Data inaccuracies, where poor data leads to bad financial decisions. Regulatory barriers is the legal constraints may limit cost control options. And technology cost, some solutions like EHR are costly to implement despite long-term savings. So we have to think about the long-term savings rather than short-term expenses. The cost control is crucial for the long-term success and sustainability of healthcare system. It is not just about cutting costs, it is about spending smartly, using resources efficiently, and delivering value-based care that maintains and improves outcomes for patients. A balance must always be maintained between efficiency, quality, and access. So before we end up, let's have a small sum up of whatever we have studied till now. So, effective financial management is the foundation of a strong and sustainable healthcare system. It enables healthcare providers to plan, allocate, and utilize resources in a manner that ensures quality care delivery while maintaining financial stability. Next, the budgeting plays a vital role by offering a clear roadmap for expected revenues and expenditures. It supports informed decision making, departmental accountability, and resource prioritization, which are critical in a sector where demands often exceeds available funds. Health insurance act as a financial safeguard promoting wider access to medical care, reducing out-of-pocket expenses for individuals and providing a steady revenue stream for providers. It bridges the gap between patients and the rising cost of healthcare, contributing significantly both equity and affordability of care delivery. Lastly, cost control strategies ensures that healthcare system remains efficient and viable without compromising service quality. By minimizing waste, streamlining operations, and encouraging preventive care, healthcare institutes can manage rising costs while continuing to meet the needs of growing and aging population. In conclusion, the integrity of strong financial management practices, robust budgeting, equitable insurance systems, and effective cost control measures is essential to delivering high quality, accessible, and financial sustainable healthcare services. That's all for my today's presentation. Thank you for hearing me.